I'm happy to be here to introduce the ultrasound field to you guys. So I'm 27 years old. I've been doing ultrasound for almost 5 years now. Um, I went straight out of high school to college. I went to OIT, which is Oregon Institute of Technology in Klamath Falls in the middle of nowhere. It's a 4-year program there, and it gives you an externship in your last year for 11 months. So you'll be working either at a clinic or at a hospital setting with a clinical instructor. And the way that I got into this field was I was actually in 8th grade and my mom turned 40. And when women turn 40, they have to start getting mammograms. So I went with her to her mammogram. They found a mass on her mammogram. And then from there, they went to ultrasound. And the mass, of course, is still there. And then we had to do a follow up appointment for my mom to get an ultrasound guided breast biopsy. Luckily, it came back benign, but ever since then, I was kind of like, okay, this field sounds pretty interesting. I always knew that I wanted to help people, and FBI was my other field. So very different, but it's still helping people in the public. Um, but yeah, so what got me into it was in high school, I did a lot of job shadowing. I job shadowed at Legacy Mount Hood, but there's other hospitals, wherever you guys are, that are more than willing to take high schoolers for job shadows. And then when I job shadowed, I realized that everybody went to OIT. So I was like, okay, this is just going to have to be the school that I go to. And I didn't really want to leave the state either. And Klamath Falls is actually very cheap, like living wise, when you're a student. Um, but yeah, so going into the ultrasound side, so, am I able to share my screen?
You should be able to give it a try.
Oh, says disabled, but I can just talk about it. It's okay. So, with ultrasound, pretty much our job is to find pathology. I know everyone thinks we just scan cute babies all day, but that's nowhere near what we do. You can work at a high risk maternity clinic if you do want to scan babies all day. That's an option too, or at an OB clinic. We actually scan anything from like little baby, prenatal baby brains, all the way until your last few days here. Um, you have to be able to work with others, like your patients, because you have all different types of patients from all over the place. People literally fly to the hospital that I work at because it's a cancer research hospital. People come from across the US for it as well. Um, and we work with radiologists, which are the type of doctors that we work with. So there's general radiologists, they just read like abdominal things. And then we work with women's imaging. So that's breast, OB, like pregnant people, GYN, like female body parts. And then we also work with interventional radiologists. So it never really gets boring here because we're always doing different procedures. So we also go to surgery and help surgeons up there. Most of the time, it's unfortunately like sad cases when we go to the OR. So that's another thing with this field. Like you definitely have to have you have to be a tough cookie. Some days can be really hard. I mean, you're scanning people for a reason, and usually the reason is something's wrong. It's not like a normal checkup. You're not just going to the doctors, you're specifically going in for imaging. And we are also called the social butterfly of diagnostic imaging because diagnostic imaging is like CT, X ray, MRI, cath lab, nuclear medicine, and ultrasound. For our field, we are directly next to the patient the whole time. You're holding their hand through procedures. You're there for them. You're making sure they're okay. Like it's definitely a field of compassion. Um, and you are going to see people cry when you're standing in the room and the doctor's telling them the baby doesn't have a heartbeat or sorry, you have breast cancer, almost likely. That's before we would do a breast biopsy, but usually we're able to tell. Um, but yeah, so and then for schooling, you don't need to just go to OIT. There's other schools in the United States for it. You can get your associate's degree. Or around here, I have coworkers that went to Seattle University. They have a 2-year program there. And then there's also Bellevue. They have a 2-year program there as well. That's a newer program. And I think recently Yeah, Concord, they just started an ultrasound program that also has an externship, which you really want because that pretty much sets you up to get a job right after. And yeah, but you don't have to go get a 4-year degree. But just most people in the field do have a 4-year degree from OIT for some reason, at least in the Pacific Northwest. And
PCC has a 2-year degree program through their radiology program.
oh yeah, so that one's just X-ray. If you guys were interested in X-ray, because we have X-ray students too from there.
Mm.
We don't work directly with X-ray, but I always see them and we get emails from them. Let's see. And then for training, like I said, you definitely want to do an externship. You will obtain your physics license, which is a really important thing in college. I think that's probably one of the hardest part of the ultrasound program is physics. You have to learn the physics of the machine and how it works. It's a lot of math. You don't need to use the math too much towards the end, once you're actually in the field, but it is good to be able to know the math, why the machine works the way it does, what adjustments can you make to be able to see better through a patient. And some of the exams that we do are, like I said, like some preemie babies, premature babies, we scan up here. There's a soft spot that they have. We look for brain bleeds when they're born early. Most of the time it's normal, but just in case something went wrong or they had to do CPR and it caused the brain bleed on the baby. We do pelvic ultrasounds, scrotal ultrasounds, abdominal ultrasounds, which we look at the liver, pancreas, gallbladder, kidney, aorta, pretty much everything soft tissue. The only thing that we can't see is like anything bony or cartilage related. We can see tendon stuff. We do OB, of course, pregnant people, breasts, arms, legs. But if you do go to school for imaging, like ultrasound, there are 3 different types of ultrasound. There's general, which is what I do. Pretty much we scan everything besides the heart, veins, and artery. If you wanted to look at just the heart, that field would be called echocardiogram. And that's also a field that is available at OIT. You can go specifically just for the heart. And then there's also the vascular program. And that pretty much explains itself, I'm sure. Yep. You look at veins and arteries all day. You look for blood clots in patients. And then general, we do everything else. um, yeah, let's see. And then it is a competitive field to get into, definitely. For OIT, they take 30 or 25, I can't remember exactly, it's been a few years, but 30 or 25 students a year. It is a competitive field. And if you do go to school for this, definitely you want to make sure it's a legit school because unfortunately in California, they have a lot of like online school, and this is not a program that you can do online at all. You have to be hands-on. And one thing I really liked about OIT is the hands-on training you have. You have practicals pretty weekly and you're scanning, you're learning how to scan different people in your class, like normal people first before you go into your externship. So you'll have a practical of like your thyroid and your abdomen or pelvic, like just up top, and looking at veins and arteries. Because for general ultrasound at OIT, we actually do learn a little bit of the veins and artery and the heart stuff. Because if you were to work in La Grande, Oregon, it's not a big enough place for it to have its own heart clinic or their own vascular clinic. But luckily, where I work, it's a very big hospital. So we do have our own vascular and our own heart clinic. So we don't have to do that. But if I leave, I might relearn it again someday. And for sure, ultrasound is always a growing field since it is technology. It's always getting better. They're always going to need us because we are not a very invasive field. There's no radiation or anything. I know a lot of people are scared of like x-rays and CTs because of that. And a lot of people don't like MRIs because they're claustrophobic. So ultrasound is a great way to be evaluated. And we also can pretty much we can scan anybody in this field because unfortunately in some other stuff like CT and MRI, depending on your weight and size, they may or may not be able to help you. But ultrasound, it doesn't matter. We can help you. And that leads me into the ergonomics of it. Ultrasound can be a little bit physical, we're using our right side, we're pushing on patients all day. So in college, you will have an ergonomics class because unfortunately, this field it does have a lot of rotator cuff injuries because you're not doing the right ergonomics. So we do learn a lot about that, ways to like hold up patients and stuff like that. And then we don't have to move patients too much like onto the stretcher. Usually they're walkie-talkie, they can walk into the clinic, so they usually can get on the bed. Or if they're already in the hospital, they can just come down in a stretcher and we don't ever have to move them because X-ray does have a lot of like moving the patient, flipping the patient around and whatnot. Um, and then I know everyone wants to know about the money part of ultrasound probably too. Um, Probably starting now in Oregon, it has to be like 35 to $38 an hour, and most of us get paid at least $80,000 a year or more in Oregon. I'm not sure about like California. It's probably a little higher because higher cost of living and whatnot. And yeah, so you for us we get paid every 2 weeks. And if you do like traveling, there's like traveling ultrasound jobs too. Some places they'll pay you 4,800 a week. So that's pretty crazy. I need to do that maybe someday. But if you like to travel, like that's a good way to start too. And you don't have any commitments, traveling across the US and getting paid for it way more than you would, like me at a local job. And they pay you stipends, which people really like. You get to pick where you live. So that's the other perk if you're young and want to travel the US and see what it looks like out there. Um, yeah, we get raises yearly, usually twice a year, because they always do a market check, see how much the other techs are getting paid in Oregon, and either go up or we're at a good point. But yeah. Um, Sorry, I'm just
On
looking.
that, do you know what the, like, kind of further end of the scale is? Like, as you continue to work in your career, is there a maximum or, like, a, I don't
Mhm.
know, cap
Yeah, so
to the
there
income?
is a maximum. I'm not sure. I haven't gotten to the OG point yet, like my coworkers, but they make probably at least like 60, $63 an hour. So
Okay.
it does go up quite a bit. And even though schooling can be really expensive, like I had no student loans. I mean, I have student loans. I had no scholarships, no help, no parents' money or anything. And I owed $80,000 when got out. But now I'm at a halfway point. So pretty good for just working for 5 years, days. Because I know, yeah, the student loans can be really stressful sometimes, but the field does pay off for it. And then there's a differential pay for depending what shift you work. If you work day shift, it's just the general pay, at least at my hospital. And then when you work swing shift, you get paid 250 extra per hour because you're working swing shift. And then when you work graveyard, you get 350 extra per hour. And then holidays is time and a half. And if you work graveyard, it's like a double win. So that's always cool way to make extra money. And I always try to plan that out around the holidays to make sure I get some extra income. Um, yeah, and then for ongoing training, we have what's called continuing education. You can do that. For us, we could do it at our hospital. We have monthly case reviews and you get 1 credit each time. Or there's conferences that you can pay for that you can go to. They're like big conferences that go over ultrasound cases with you guys. They do cost a few $100s usually, but they usually pick fun spots like Vegas, Hawaii, so at least you can have fun when you're not working and learning. And then, of course, we have to have CPR because you are in the medical field, so you will have to get your CPR renewed every 2 years. And a normal day for me, it's kind of different because where I work at 3 different places, but it's all on the same campus. So I have a clinic setting. Those patients, usually it's like follow-ups for things we already know about, like they have a nodule on their thyroid, which a lot of people here do. We do a lot of thyroid ultrasounds, or they know that they have hepatitis C and it's just a yearly checkup on their liver to see what it looks like, or it's just like acute pain, nothing too crazy, usually the clinic setting. And we work for me, I work 7 to 5:30. And then if I'm at the breast center, that's a different place itself. That's a place where it's also mammography, like where women get their breast exam, but men can also too, if they see a lump, men can get breast cancer too. People don't know about that. We have seen it there at least 5 times since I've been here now. But yeah, the breast center, it can be a little stressful because the women are coming in already really stressed, thinking that they have breast cancer possibly, or they have a family history of breast cancer that makes them more high risk. So it's again already stressful because they usually will start in mammography and then they go to ultrasound because we probably saw something. So like that's what brought me into this field originally. And yeah, like you just have to be really comforting. And for the breast center, the radiologist will come in and they will tell them either this is very suspicious or it's definitely cancer, or we need to do a biopsy. And that's one thing that we do a lot is we do a lot of biopsies. We do breast biopsies, liver biopsy, kidney biopsies, whatever lumps, bumps you have, we can usually biopsy it under ultrasound. We also place drains in patients, like if they have an, not me, the radiologist, um, we'll leave a drain in them so it can drain out the infection, and then we'll reevaluate them in a few days to see if it's gotten better. We drain fluid out of people's bellies because usually they have liver disease, so their abdomens get really large and filled with what's called ascites. It usually comes out as yellow fluid. So this is like hospital stuff, of course. We do what's called thoracentesis. We drain fluid from people's backs between their ribs because they either have congestive heart failure, they have cancer, they're going through chemo. You can kind of tell what's going on with them too when the fluid comes out when you are in the field. Yellow is usually normal, pink is usually they're going through chemo. Bloody is either something's bleeding, of course, or they had a procedure prior to this. Trying to think of everything to do. We do so many things. So you don't really get bored. So it's nice, especially if you want to work at a hospital. You have lots of different things to scan. Some of the not pretty stuff at the hospital is the ERs that we can get. Lots of abscesses on patients' arms and legs. And you have to have a poker face, even really, if it's really smelly. You have to have a poker face because, they're in a lot of pain if it is an infection. Usually they're coming in, they got an open wound, and I have to evaluate it with, of course, a sterile probe cover over the camera. I wouldn't just scan them with that. And then when we go to the OR, sometimes we help with cancer cases. I've gone up there for like a head and neck cancer, and I'm scanning right here and the surgeon's here, and then there's a person that's doing the radiation at the same time. So you're fully suited up in the OR for that, and you're just guiding them exactly into the mass that they're targeting, making sure that we don't hit any other important structures. Yeah. And then for sure, if you are interested in this field, I definitely recommend doing job shadows, like reaching out to diagnostic imaging. You can just call them because we are taking high schoolers again. I know during COVID we weren't doing that, but recently they are doing that again. Yeah, definitely do job shadows, see if it's something that you are interested in. I definitely had no idea what I was looking at when I was job shadowing, so don't feel like, oh, I have no idea how I'm going to learn that. You will. Because yeah, it's hard, but and then once you are in the ultrasound program, you learn a lot of pathologies. Like I spent one whole term just learning about liver pathology and one whole term just OB, breast, like everything. And then you'll be able to scan each other and learn the different grays. What does a bright gray mean? What does a dark mean? And depending what body part, it's going to mean different things. Sorry, just looking through the questions. And if anyone has
So
questions,
can I ask, what are the licensing requirements in Oregon? So you go through the program, it's that 4-year degree program, and you learn all of the pieces of the pathology and the diagnostic part. So then when you finish, is there an exam you have to take? Is there state
Mhm.
boards? What does that look like?
Yeah, so once you get your degree, like for me, I have a bachelor's degree in science of diagnostic medical sonography. But before I even went on externship, I already took that physics test that I was telling you guys for. You have to pass your physics test to be able to do ultrasound. That's for sure one license you need. And then from there, you can kind of choose. It depends. Like if you are doing just the heart, you'll just take the heart board. And then if you are doing vasculature, you'll get what's called your RVT, registered vascular technologist. That means you are able to scan the veins and arteries. And for me, I have my boards in abdomen, small parts. So you can choose which one you want to take first, abdomen, small parts, or OBGYN. Abdomen, small parts is a little harder. So I took that first. And that is a license that will cover, and you can scan anything even with this license. But it's abdomen, scrotal, lumps and bumps on patients' bodies, thyroid. And then OBGYN is what it sounds like, female parts and then pregnancies. So you can have either one of those and you can scan everything for general ultrasound. So you'll be a registered diagnostic medical sonographer is what's going to be on your badge. And you can get further licensings if you want. Some places will pay you more, like if you get your breast license or if you somehow have all of them, which some people do because they've worked at small hospitals. I haven't, so I don't need all of it because it's not necessary for me at this time. So for sure, you'll have 3 boards you'll have to take. But yeah.
And then that license is it, do you need to renew it so many years? And I know
So it's just,
you
yeah.
touched a little bit about ongoing continuing education.
Yeah, so it's
Is
just going
there,
education. Just
what was
like
that?
30 credits every 2 years. And you'll be already like signed up for the ARDMS, which is the ultrasound website registry. You could type in anybody's name to see if they're legit that way. And they'll let you know how many credits you have left. And you can also do like a Society of Diagnostic Imaging, which is a further way to look into that. But most people don't really have that in ultrasound, at least in Oregon. And then the other thing about Oregon license is because it's Oregon, so they like to do a little extra licensing. Oregon does have a diagnostic medical imaging license you have to have that you get every 2 years. And it's a $250 fee right now. So yeah, so you
Does
make sure you
that,
have that.
does that allow you, once you have passed those boards, if you say move down to California or to just any other different state, do you have to take tests in that particular state and get licensed there, or once you've done it, you're good wherever you
Once
want to
you've done
work?
it, you're good everywhere. You just got to do your continuing education. Oregon and I think New Jersey's the only 2 that has like it's like a license you have to pay for, but it's not a test. You just pay for the fee that they make you pay. And if you don't pay that, your boss will send you home because I did that my first year. I forgot. So very important to do that, and you can just pay for it, come right back to work. Let's see. And then if you're not interested in ultrasound, but you are interested in other parts of diagnostic imaging, you can always job shadow X-ray, CT, MRI, and also nuclear medicine. Personally, I don't know too much about nuclear medicine, so I can't talk on that one, but CT is a lot of trauma. If you like trauma, they just throw the patient in the machine, the long tubing, get them in and out. They put contrast, so you will have to learn how to place IVs if you do MRI, nuclear medicine, or CT. I don't know how to do that, but I could probably figure it out. And then X-ray, it could be pretty trauma too. They're up in the ER a lot. And they go to the OR a lot. They're scanning while the surgeon's placing something, and then to make sure it's in place, like a pacemaker, they can usually see that pretty well. But yeah, those are pretty quick fields. Like you're seeing the patient only for a quick second, maybe. That's why we're the social butterflies, where we're sitting here scanning, like, can you roll this way? Can you take in a breath? Can you scooch towards me? It's a lot of making sure they're close to you and and then you just kind of talk them through step by step because a lot of people are worried about being there. So I always try to reassure my patient, like, okay, so this is what we're gonna do. You're gonna feel pressure over here. We're gonna do this next. Let me know if it's uncomfortable. Making sure they're comfortable at all times, but obviously they come through the ER. Sometimes they're not comfortable. They're in there for pain. We get a lot of ER cases all the time. And I think people don't realize that ultrasound scans a lot of people through the ER. It's pretty high intensity. Um, like I've literally wiped blood from a woman's foot because she was miscarriaging so bad. Like, I mean, you know, being in this field, you are gonna like be compassionate. Like, I'm not just gonna let you try to clean off the blood that's coming out of you when you're in the middle of a miscarriage. You're already in such a bad situation. And there's a lot of
In the
gallbladder.
classes that you take, is that some of the like psychology and how you navigate those conversations with the clients that you're working with or the patients you're working with?
It's not we don't have like a psychology class that we take, but they talk about it a lot in the field. Like you need to be able to calm the patient down, obviously help them out. Like I just kind of put myself in their shoes, like what would I want if I was in this situation? Um, and you have to have a really good poker face in this field because the things that you see. Luckily, we still wear masks with our patients when we have patient care, so that kind of helps. But without the mask, you definitely want to have a good poker face because we're not the ones diagnosing, we're the ones helping the radiologist diagnose because we're not going to be the ones ever giving the results. And that's one thing patients will always ask you, do you see anything? Is something wrong? And then you just have to be nice, like, sorry, I don't have my doctor's degree. So unfortunately, you're gonna have to wait for the radiologist to give you the results. But most of the time you're gonna know what's going on. Pretty much sometimes we just you will have to write a report in ultrasound, unlike any other imaging modality. You are writing exactly what you're thinking, what the diagnosis is, you're describing the masses that you're seeing, and it's reliant on you a lot because the radiologist isn't the one scanning, it's you. And if they disagree with you for something, you will have the awkward conversation, but they're always willing to hear like why you're thinking that, or maybe they'll correct you and you'll be like, oh, okay, maybe it is this other thing. So it's always a learning opportunity in this field. A lot of, yeah, you just definitely have to be able to take criticism from the radiologist. And it's never in a mean way. It's like, okay, you could have tweaked this picture better, or maybe you could have described it in a better way, because there's a lot of ultrasound dialect that you will learn when you are in school, like echogenic, hypoechoic. Like people here probably don't know what that is, but those are all like ultrasound terminologies. And then at our hospital, we also work with high risk pregnancies sometimes. The doctors will come over, they're called MFM doctors. We will Doppler, which means take blood flow around the baby's umbilical cord while they're inside to see if they have sufficient blood supply from the mom. And if they don't, then they either would have to do something or unfortunately, baby will have to get delivered. So a lot of important cases, you're kind of always in like a serious situation. So definitely keep the poker face on. And then if you ever get confused, the good thing with ultrasound is not just all pictures. You can just take video clips. If you don't know what you're looking at, take video clips, left, right, label where you're at, and just talk to your doctor about it like afterwards. Because sometimes like patients pathology is such a mess that you don't even know how to describe it, and you're like, I don't even know what's going on in there. Like for example, some patients have ectopic pregnancies, which means they get pregnant, it's not where it's supposed to be, like where girls have their periods. It's either in the tubing or in the ovaries, and it can rupture, and then that patient's bleeding out internally, and on ultrasound it's just a mess. Like you can't see what's going on, you're like, this something is not right. So that's a good way to prove it too. So ultrasound is not just still images. You can take video clips, you can put color on, it can see blood flow. There's blood flows to certain organs or it got cut off. Yeah. Anyone have questions, by the way? You can ask now too. You can always cut me off. No, no.
With
Okay.
everyone on here, does anybody have any questions?
Let's see. So aspects of the job that I like I said, I like to help people. So knowing that I'm in this field, I'm there to help them and either start the process of their cancer journey and guiding them to the right oncologist, breast surgeon, and reassuring them that everything will be okay is definitely a really good part. But the downside, the hard part is you're there when they're diagnosed with the cancer most of the time, not always, and you're there when they get the bad news. So that can be the hard part. Sorry. Um, and then I would say another downside is it can be very stressful at times. So I'm a pretty empathetic person. So if I see somebody cry, I have to look away when my patient's crying just for a second because I'm like, I can't start crying. I have to be the strong one for them. But yeah, overall, like my coworkers are great. Most of the people in the ultrasound field, I hear that all their coworkers are great. They get along. The doctors are always there for you most of the time. Obviously, there's some I'm sure out there that are not. And just being able to see and know all this pathology. I know a lot of people don't like to know that stuff, but I'm the type of person like I'm glad, I'm thankful I'm in a field where I know all these types of cancers, all these symptoms, and I can kind of link them together. I'm like, okay, that sounds like appendicitis. Okay, that sounds like pancreatic cancer. Okay, that sounds like a miscarriage. So you're kind of just piecing the puzzle together and you're able to really help the doctor diagnose the patient.
We had one of the middle schoolers ask if you can speak additional languages, can that increase your pay? And then I have a follow-up question to that is, do you speak additional languages?
Yes. So I speak Vietnamese too. I'm not fluent, but enough to like have a conversation. Like I don't know medical words, so I don't have that certification. But there are hospitals that you can get certified in whichever language you speak or you want to be able to speak, and then you can get paid more, which is nice. I would say the demographic of where I work is a lot of Vietnamese patients because I'm in the middle of Portland, and then a lot of Hispanic patients. So I know like a little Spanish. So even if you just say like a little bits of things, like instantly it makes the patients happy. They're like, oh, you're trying. But yeah. Mhm.
What does a day in the life look like? So when you get to work in the morning, do you get to have some say into who you are working with, or do you just get directed who's next? Tell us a
Yeah.
little bit about what it looks like.
For me, it's different. Like it depends which location I'm working at. If I'm working at the hospital, it's just me and another tech. And then we just one after the other. She goes first, I go next. Just bounce back and forth pretty much all day. And then for us, we have transportation. So we'll wait for transportation in between. It's nice because we don't have to always go portable to the patient's room because that's always an adventure to try to figure out and find a plug-in up there and move them around. Yeah, so pretty much at the hospital it's just one after the other because they're ERs, they're inpatients, and we have scheduled patients and procedures as well. So it's a little bit chaotic when I work there, but it's always fun because it's always different things. And then the breast center is scheduled some ultrasound and then some ultrasound guided breast biopsies or fluid aspiration if a patient has like a cyst or a seroma, which is a fluid collection after a patient has had the breast cut off, called a mastectomy. Um, and then there it's kind of different because some patients are coming into mammography, they're getting their mammogram, and most likely they're going to go to ultrasound. So sometimes they'll go to ultrasound, sometimes whatever they're looking for went away on the second mammogram with more pressure. So there it's kind of like you're not really know where you're gonna get, can be really chaotic some days, and then just hanging out other days. And then the clinic is you just pick a room. There's like 7 rooms. You just pick whichever room, and it doesn't really matter which room, except for we have students that are on externship. So they'll pick a room with the clinical instructor, one of my coworkers, which room they want to be in. Usually it's whatever they're targeting to learn at the time. And then you just, yeah, stay in that room all day and then you're out of there.
And then after a patient leaves, do you write reports then, or do you do reports at the end of the day?
Yeah, so you have to do it right after. So you always type it up right away. We have a system that pulls up images on this screen. It's a dual screen. And then you'll have your report over here. You'll type in their history, like patients had right upper quadrant pain times 10 weeks with nausea and vomiting. And then you're going to go down to each organ that you looked at. So like for abdomen is liver, you'll have the liver measurement. And then you'll write how the liver looks, their echogenicity, which is one of the words you would learn. So that would be able to tell if a patient has liver disease or not. And then the kidneys, you write if there's urine backed up into the kidneys, if you see kidney stones or not, or if it just looks normal. And then the gallbladder can have a lot of problems. It can have gallstones, you can get infection, it can have what's called a polyp. You would just describe if you saw any of that. And same thing with all the other things like the aorta, the IVC. If you see a mass, definitely you're going to describe that. And anytime you see a mass, most likely that patient will be getting a biopsy. So you definitely want to make sure it's a real mass. And you also want to make sure you're not just kind of letting it go. You're like, maybe it's not real. But what if it is real? So you do want to document it, and they can get further imaging before they get a biopsy. They can get a CT or an MRI to really see if it's a real mass or not. Because on ultrasound, you can make things up, but that's why they start with us, the cheapest modality and no radiation. And then if they need to further evaluate, they would go to CT or MRI. Yeah.
Were
What
there
are
any
some of-
classes in oh, sorry, Sam.
No,
Were
go
there
ahead.
any classes in high school that you took that were really helpful for when you applied to go to school at OIT? And for those students here who are interested in pursuing this field, what classes would you recommend that they take?
There was nothing really specific, honestly, for ultrasound. I would just say take as many college credit classes as you can. That's what I did. So I came into college with 40 credits. So that cut like half of my prerequisites that I needed to take. If you can, I would take chemistry, but OIT is sometimes really hard to transfer your credits in because it's like a specialty school. So it can be difficult. You can look into that through the OIT program website. But yeah. Oh, I think you're muted.
Sorry, I linked for everyone the program at OIT, and then also the 2-year degree program to Concord is in the chat
Perfect.
box.
And then the thing with the OIT, you will have an in-person interview. That's a good thing to know. I kind of prep myself up for that. You will be interviewed by the 2 women that run the department pretty much, I mean the program. And everyone told me when I did my job shadows, they said, do not say I want to scan babies. If you go to that program, just don't say that because you're automatically, somebody said that my year and he instantly, they're like, nope, not doing it. Because it's not all rainbows and sunshine. Like we do scan babies, like anatomy, everything looks normal, but a lot of the times it's not normal. Good question. Wait, I can't hear her. I can't hear you. Dang it. Yeah, I can read the questions in here. What's been the weirdest diagnosis you found? I've seen a lot of weird things. Well, one weird thing that we can develop for your question, Tessa, is what's called a dermoid. A dermoid is your ovary, but it develops teeth, hair, and on ultrasound, it just looks like a mess. But when they take it out, you can like physically see the teeth that's growing on the ovary, the hair that's growing on it, the mucus that's growing on it. It's pretty gross. They call it the monster. um, that's probably one of the weirdest things. And I've also seen a baby that didn't have his abdomen was open, so he didn't have the front part of his belly, so his guts were hanging out, which is a diagnosis that we see very well on ultrasound. It's depending on which kind, some of them have a sac around it, but not the actual abdomen around it. And then the one that's just floating, that one's easier to treat because when the baby's born, pretty much all of their guts would be hanging out and they would put a band around the baby, pushing everything back in. Eventually, they'll be able to sew it up, which is pretty crazy to me. um, and then, can high schools do the program? No, you have to be graduated from high school. You need a high school degree for it. Any other questions?
Angel, I can't remember where do you work at again?
I work at Providence, Portland.
At
Medical
Providence.
Center.
Okay.
I'm right off I-84.
Yeah.
Yeah, so if you want a job shadow there, I'm sure my lead would be more than happy to let you. I think you do have to be 18 years old though. I can double check. I'll let you guys know.
Sam, were you able to get unmuted?
The middle schoolers would love to know why the field is called ultrasound. Okay, we can go back to the roots of ultrasound. Ultrasound, I don't remember when it even came about, honestly. It's been a while since I learned that part of school. But ultrasound started back in the day with people in bathtubs. So we're using sound waves through the probe and we're sending the sound waves through the patient and it needs some kind of gel base. So when people get ultrasounds, there's always a jelly thing that gets squeezed on you, and that is our transmission. And then we send sound waves with frequencies that go to the organs, and certain things won't send the sound wave all the way through. It's usually a solid mass or something, because then it'll send the sound waves, it'll come back towards you. So that's a lot of the physics part is you're sending sound waves in, why is it not penetrating all the way through the organ? And there's, once you learn all the physics, you can toggle the knobs and figure out how you can see better on this patient because everybody's body's different composition and ages, of course. And then just going over the questions. And then, yeah, once you're in this field, I mean, it's a pretty good paying job already. I have patients that ask me, they're like, oh, like, are you going to become a doctor? You don't have to become a doctor. It's a great paying field as it is, but you can become a radiologist if you wanted and pick your specialty from there. What kind of radiologist? Is your mic working, Sammy?
I don't know. Is it working now?
Yeah.
Yeah. Okay. Excellent.
Did you have a question you were going to ask me to share?
I was gonna read a couple from the chat, and then you went ahead and did so.
I was like, I didn't do that.
Thank you.
You're welcome. Yeah, that's all I really have on ultrasound. But if anyone has anything else,
What is maybe your least favorite aspect of the job?
like definitely the diagnosis part, can be really hard. And sometimes you do butt heads with the doctor. It's gonna happen. It happens to everybody. You just have different of opinions, and then sometimes there's just so much stuff going on that there will be a little bit of headbutting. But at the end of the day, everyone comes back together, and then it's all fine. But that can be difficult at times, and I have heard like horror stories. There are some terrible radiologists to work for, but luckily where I work, I love all my doctors. I would trust them if I was the patient. You mainly work with kids in this field or mostly seeing adults? I work with all ages. So I work, like I said, from patients before they're born. So when the mom's pregnant till the last days of your life. So it ranges every day. You never know what patients you're going to get. But if I were to be working at Emmanuel Hospital, where they have a big child center, Dornbecker's next door, then I would be scanning more kids for sure. If that's what you're interested in, is doing peds. I mean, it's pretty much the same thing as adults. We all have the same organs. You're just going to be looking for it on a different age group. And then one thing to know with that is there's different ways to talk to people. You're not going to talk to an adult the way you're going to explain the ultrasound to like a 5-year-old kid. You're going to be like, I have this space goo. I'm going to use this to see through you. Sometimes you have to let them play with it because they're terrified or screaming already. Yeah, we scan baby spines. Obviously, babies don't really know anything. So you just kind of make sure the mom's there comforting the baby. But when they're toddlers or little kids, you definitely have to kind of break it down a little bit more for them, make it more kid style. And then, do
How
you
do
know?
you how do you see the industry or the field that you're in growing and changing over the next few years compared to where you started?
I think probably won't change too much. If anything, it'll just be like better ultrasound machines. Not much has changed in the last 5 years since I've been doing it, because ultrasound's pretty well, I feel like, established, I guess is the best way to say it. We know what we're in for, we know what we're doing. We know we can go to the OR and like what we can detect. If anything, it'd be like different devices that we can place in patients, because we did get like 2 new devices we can place in patients at the breast center for breast cancer. So that's always cool.
Do you get training on how to use the new equipment? Is that a
Yeah, so the person from that company, like for us is GE, like a GE person will come in for about a week or so. They're pretty similar. Like we got these new ultrasound machines like a little over a year ago. They're pretty similar, just a lot nicer. I could see better. They're always the same ultrasound probes. There's a lot of ultrasound probes, but they're always the same on every single machine. So that's a nice part. And they're always the same frequency. So there's different frequency ranges, all the physics parts of it.
what makes the difference between having a full bladder and an empty bladder? I never quite knew that.
For that, that's usually for women, or if somebody is coming in for a renal ultrasound. Sometimes it's just for the measurement to see how much a patient has. They go pee, and if they emptied it out. And then for pregnant women, our uterus is like this, and then when you pee, it goes like this. So the way the ultrasound penetrates, it uses your bladder as a window, goes through your bladder to the uterus so that you're able to see better. Or like a pelvic ultrasound, same thing, just flattens out your uterus, goes below the bladder, and you're able to see better that way.
So if a male is having an ultrasound done, do they have to, is that the same where you'd want them to have a full bladder and an empty bladder?
It just depends what exam they're getting. The only time a male would have a full bladder is a kidney ultrasound, which can be done male or female. You need a full bladder for that because your bladder's full, and then if you have what's called hydronephrosis, it's urine backed up into the kidneys, we'll be able to see if you have something or some kind of blockage that's causing that. Or they have like a bad bladder, like they can't really empty their bladder, so then they'll go pee. Sometimes they'll come back, it's even bigger. I'm like, how did that even happen? Usually those are in like, of course, the older patients. And if it's over a certain amount, we have to send them to the ER. They get a Foley catheter and they'll have to drain them. I'm just reading some of these questions. Do you know of any internships or externships for high schoolers in this field? Unfortunately, I don't think there is any, just because it's so close to the patients. You're working, in the hospital and whatnot. The only thing I would think is that the job shadows for high schoolers, that's what I did. And you can job shadow. I job shadowed at a hospital, but it was more like clinical setting. That would be like at my hospital too. You'd be more watching the clinical side of it. Have you ever cried during a time with a patient? What have been some of the worst situations you've been in? There's been a lot. I think the worst situation I've been in is I was a student, and then they called ultrasound. They're like, we need you stat right up here in the OR in maternity, which is where the pregnant ladies are. So that me and my clinical instructor, not my coworker, We go running up there with the machine, and this lady had just given birth. There's blood everywhere, all over the floor. There's like 12 doctors in the room, 30 nurses in the room. They're pushing blood back in this patient, 6 bags full of blood. There's blood on the ultrasound machine now because the patient's placenta didn't detach. So then they're trying to pull it, but it's connected by blood vessels. So they pretty much gave her an ultimatum. They're like, do you want to have kids anymore? Because we might need to take the whole uterus out right now. And if you do, you still might die. That's literally what they told her. And they had to pull her husband in and ask her as she's like bleeding out and everything. So that was pretty crazy. Um, and I have definitely cried with the patient before. Yeah, I've cried with a few patients. You know, they'll just start crying, or they don't have somebody with them, and they just hug me, and then I just start crying when people hug me and they're crying, and I just cry with them. I just say we're gonna figure this out. You're not alone in the situation. Um, yeah. And then how old do you have to be to start shadowing? I think 18, just for liability reasons, but I'll find out from my manager, my lead, and then I'll let Sammy or Karen know, and they can let you guys know. We'll see. But yeah, if you guys have any other questions, I'm more than happy to answer them now, or if you come up with them later, you can just send it to Sammy or Karen, and they can email me. You guys can, if you guys want to share my email, I'm more than happy to talk to them too. I have people ask me all the time about ultrasound. Do you know about any other shadow jobs or internships in health fields other than GYN? Yeah, so I'm not just GYN. So we had people come, they watch everything that we do. They watch abdominal ultrasound, thyroids, they can watch some of our procedures that we do at the clinic. But there's also, you can also job shadow like X-ray, CT too, if you wanted to do the other diagnostic imaging fields. And I think
So when you were looking for your externship, was that through OIT, did you say, or was it something that you sought out specifically?
yeah, so your school will already have a system, and mine was through OIT. And it was a very stressful time. It was the luck of the draw. You can end up in Alaska or Texas or Vermont too. So it's not just Oregon when you have externship. For us, they would go, okay, who wants to go to Anchorage, Alaska? And if you wanted to go, you would raise your hand. If nobody else wanted to go, you get the site. But like for Portland, everybody wanted to kind of stay at home because most of us were from Portland in the field. Um, and then let's say there's like 10 people. So 10 names will go into a fishbowl. And then they just pick a name from that fishbowl. And that's the person that goes to that field. So it can be a little stressful during that time. But yeah.
What is the best thing that you think in the last 5 years that you've worked in this field that you've learned or that you've been able to take away so far? And what are you most excited for
Yeah.
in the next few years?
I'd say I'm really grateful for all the knowledge that I've gained. I feel like a lot of people, when they get diagnosed with things, which is understandable, they think it's the end of the world. But like, I've seen so many miraculous things happen. Like patients get diagnosed with breast cancer. I see them 5 months later and they're cancer free. Or we catch a pancreatic cancer, which usually kill people in 2 to 4 months. I've seen patients go have the Whipple surgery, which is a 14 to 16-hour surgery, and they beat it. So it does give me hope that if something did go wrong, there most likely would be people that will always guide you to the right direction to get help or to, beat the cancer or whatever it is. And I'm just excited to just keep learning, honestly, because we're always kind of learning new things, and I'm sure there'll be some new diagnoses as times change, Like during COVID, it didn't honestly change much. The only thing is we were like more PPE and stuff like that. And we did a lot of air, cleaning and stuff like that. Yeah, so it's definitely a good field to be in. You get to know so much about the human body that the average person does not know at all. And a lot of my friends will just ask me, can you feel this low? Sure, why not? I could feel it for you. Or they'll just tell me, like, what do you think I should do? And I usually can give them an answer, at least a little guidance, you know? It's nice to be that medical person in my family for sure, because I'm the only one.
I know in answer to the questions about the internships for high school students, COVID, the restrictions kind of halted a lot of the programs at Providence and Legacy, Kaiser, OHSU. Some of them are starting to come back. They really need to get because of the shortage of healthcare workers and the demand, that students who are actually college students who are in programs like at PCC or Concord or OIT, they're getting the preference for the job shadowing and the clinicals. If you're in high school and you're wanting to have some opportunities to job shadow at the Hillsborough Medical Center, which used to be Tuality in downtown Hillsborough, and then at the West Side Kaiser Permanente, they are taking volunteers. There's volunteer opportunities that you can go onto the website and look at. Also, your college career coordinators should have that information. If not, I'll make sure that we get it sent over to them. But you have to do so many hours of volunteering, and then they will hook you up with somebody to job shadow. So that's the latest that what we heard from Kaiser Permanente, and then at the Hillsborough Medical Center. We don't really, we haven't done much with Providence. If you're a Beaverton School District student, check with Paula Jacobs over at Beaverton High School in the Health Sciences program there. And then if you're in the health sciences program, either at Liberty or Century, if you're an HSD student, talk with those teachers there, and they can let you know about opportunities to actually get in and do the volunteering, and then what else you need to have to job shadow. I know at Hillsborough Medical Center, you have to have 100 hours of volunteer work before you can job shadow. So
yeah, it might be different from when I was in high school now, but
yeah,
COVID
has changed. COVID has changed because of the workforce shortages. And I think that, like what you were saying, right, that what's the future outlook is that there is such a demand ultrasound, any of the other diagnostic like CT and CAT scan, that is a field that needs lots of new people coming in, because there's a lot of people who have are retiring, and it can't be replaced by automation, right? It requires the hands-on people to do the work.
Yeah, for